There you go.
Thank you, Ray. I'd like to welcome everybody to our Monday, January 10th Board of Health meeting. It is 6:01. I'm in Utah, so my clock says 4:01. And welcome. I guess our first thing is a call to order. And then just to mention, we have Sue Hanley, Zach Cataldo, Stephanie Granger, Michelle Petoniak Crawford, and Joanne is not present, Joanne Belange. Our first agenda item is the approval for the minutes for the meetings on October 13th.
All right, I'm back.
Okay, great, Michelle. All right, we're on, so.
Okay.
Our first, is approval of the minutes for October 13th, 2021. Does anybody have any comments?
I have a few comments. Page 2, 4072 Groton Road, second line, housing cases that caught fire over a year. Just add ago. And then throughout both sets of minutes, COVID is spelled differently. It's like either lowercase or uppercase, or in one case it's COID on page 3 of these minutes. So I think we just need consistency. What are we going to be calling it? And that applies to both sets of minutes.
So it's also in COVID-19 in bolds.
Right.
What do we want it to go through and be corrected to?
Well, I guess it's an acronym, so it should be all caps with the 19, I think.
Yeah,
Okay.
I agree.
Yeah.
Any other comments?
I just had one. So for both the October and the November, Ray, it says that you were absent, and yet it says all the way through it, like Ray says, Dick says this. Were you not there for both of those?
I think it just...
Or is that saying staff present, absent nobody?
I was here for all of those meetings.
I know. So maybe it's just saying, it's just the way it looks like absent staff, Ray, Dick, but maybe it means nobody was absent.
Maybe we could just add the word none.
Mm-hmm.
Yeah, something, because yeah. For both the October, and then I was like, I thought she was there for those. Yeah.
Okay.
Any other comments on the minutes from the October 13th? Is there a motion then to accept those minutes?
I'll make that motion.
Okay, Michelle Crawford makes the motion. Is there a second?
I'll second.
Zach Cataldo seconds, and we have been told that we need to roll call vote because of being on Zoom. So Stephanie Granger, aye. Sue Hanley?
Aye.
Michelle Crawford?
Aye.
Zach Cataldo?
Aye.
Okay, motion to approve the minutes passes unanimously. And next we have the November 8th minutes. So again, we want to standardize COVID-19 to be caps and COVID-19, and we want to add none under absent. Any other comments on those?
That was all I had.
Then I'll make a motion to accept those minutes. Is there a second?
I'll second.
Or I guess a motion to accept them with those slight amendments. Sue, you second?
I'll second. Yep.
All right. And let's see. Stephanie Granger, aye. Sue Hanley,
Aye.
Michelle,
Aye.
Zach.
Aye.
Okay, that motion to accept those minutes with the noted changes passes unanimously. All right. So next we have the variance request for 10 Pond Road. Ray, they had commented in the Q&A that they were muted. I think now we're able to unmute them to join the discussion.
Mm-hmm. Absolutely.
Would you like to fill in the information on this?
Sure, absolutely. Let me just make sure I have Aaron.
Solutions.
Hi, yes, I'm here. Can you hear me?
Yes.
And we should have Kevin Ritchie. Hi, Kevin from Civil
Hi.
Solutions on.
Yes, I'm here.
Okay.
Hi, welcome.
So Kevin is here from Civil Solutions for a variance request for 10 Pond Road relative to the upgrade of a failed septic system. You can see here we have several state variance requests, and the layout for 10 Pond Road was put in your packet, which I can certainly bring up. Kevin, do you want to speak to the request you're asking for tonight on behalf of the homeowner?
Sure. So 10 Pond Road's down off of Dunstable Road. The houses are all kind of on small little lots, and they are served by wells. So there's no town water down there. The offsets to the wells and the lot sizes are the biggest issue down there. So we've got several variances. We've notified the abutters, the necessary abutters, the affected abutters. And I can, if Ray maybe wants to bring up the plan, I can kind of go over where we're at down there.
Mm-hmm. Bringing that up now. Mm-hmm.
So Aaron is the homeowner of 10 Pond.
Okay. And we're sharing that. Yeah. Bear with me, I'll put it right side. One more time. Can you see that?
Yeah.
All right, let me blow it up a little bit. Okay. How's that?
It's great. Thank you, Ray.
Sure.
Okay, so I don't know if you can you see was my mouse active?
I think
kind of
so.
Yeah.
Yes.
Okay. So we've got 10 Pond. We've got Dunstable Road up here. We come down Pond Road. There's Hillside here, and then Dell Road on the back side. So here's the subject property, 10 Pond. You can see his well here in the front corner. The neighbor's well at number 8 Pond is here. The well for 7 Dell is here. The well for, I believe it's 12 Pond is back in here, and 9 Pond across the street. So those are all, and then 6 Pond is up a little further. So currently there's an existing septic tank here in the backyard, and some kind of leach field here in the side yard. We've got a 50-foot well arc here from 7 Dell, 100 feet from 6 Pond. Here's the 50-foot from 10 Pond, 100 foot from 12 Pond. That's not really an issue. The 50-foot well arc for 8 Pond is here. So you can kind of see the well arcs they occupy a lot of space. There's no place in this yard that's outside all the hundreds. Again, the current system is here. Basically, we're going to be a minimum of 50 feet from anybody's well. The closest one will be here at 7 Dell. We're 50.5 feet off of that well with the leaching area. And we're 50.5 feet off the well arc for the subject property. And the existing system, just a septic tank and some kind of leach field. Most likely it's in the groundwater. They did have all the wells, the affected wells tested. And to the best of my knowledge, they all came back clean. So what we're proposing is to eliminate the existing septic tank and put in a jet aerobic treatment system. Then we will pump it and pressure dose it into a geomat leaching field. So the effluent should become a lot cleaner than it is currently. And again, the current system does not seem to be affecting anybody's well. You're all.
Go ahead, sorry.
So I'll go through the variances and kind of talk it as we go. So we're 8 feet off the lot. So here's 7 Dell, the leaching area here. In order to get it between the outside the 50-foot well arcs, which would be Title 5, or the minimum Title 5, we're 8 feet off of the property line here at 7 Dell. And then over here along Hillside Road, we're 6.5 feet off the property line here. So we have had to reduce those offsets. Again, we've notified all the affected abutters. So 7 Dell, they have been notified. Then as far as the well off, so those are the 2 property line offsets, 6.5 feet to Hillside Road, 8 feet to 7 Dell. Then we've got some well offsets. The leaching area, we're 50.5 feet off of 7 Dell. So that's right in this corner here, we're 50.5 feet off of 7 Dell. And up in the front, we're 50.5 feet off of 10 Pond. 8 Pond, we are 80 feet off the well, or 80 feet from the well to the leaching area. And then at 9 Pond, which is across the street, we're 96 feet off of that. So that is one of the variances we're asking for, is to reduce the offset to these wells. Again, there's quite a bit of fill here in the backyard. We did multiple test holes, but we kept hitting either the old system, or we were into the old system, and we were hitting groundwater, so that we're using a sieve analysis, which is allowed by Title 5 under the local upgrade. The septic tanks, or the jet tank, is a jet tank here is should be 50 feet as a minimum for Title 5, 100 feet for Westford's regs. The jet tank, let's see, is 50 feet at its closest, and then the pump chamber is 45 feet off a 7 Dell, and that's at its closest. I believe it's 96 Pond. It's 96 feet off. Okay. So again, I guess to recap it, we're asking for the variances off the property lines. 7 Dell, 8 feet, 6.5 feet off hillside. We're asking to be able to place the new leaching area, which is it's got the jet innovative system, and then the geomat leaching area, which is another alternative type of system as well. And those are 50.5 feet off the 2 wells closest. Using the sieve analysis rather than a perk test, and we are reducing the offsets to the tanks from down to 45 feet at its closest pump chamber to 7. So again, the tight neighborhood, everybody's kind of in the same boat.
Yeah, that's fairly evident from that drawing. Zach, did you have a question?
Yeah, some questions for you, Kevin. So I'm not that familiar with the jet or the geomat system. That seems like a pretty cool approach. Can you just kind of give us a summary of how that system works?
Sure. So the jet is this first tank. It's basically taking the place of the septic tank. It's a 3-compartment tank. So the first compartment would act as the settling chamber, basically the same as a septic tank. It settles out the solids. The center chamber is it's an aeration chamber. It's got some fixed media in there, and then It's got a blower on it that's basically circulating air through the liquid constantly. And then the last chamber is, again, another little settling chamber. We'll have a filter in it. So it's basically an aeration chamber to treat the effluent before it heads on out. Then in this case, we've got a pump chamber here, basically to pressure dose the leaching area. The geomat is it's a very low profile type of system. Basically a 3 foot, it's like a press Presby. Comes in a roll, in this case, they're 3 feet wide. I believe we have 100 feet. I think maybe 88 feet of the geomat. And again, the beauty of the geomat is the much lower profile. Does allow, it's approved through DEP to be 5 feet off a foundation. We're more than that here. The breakout requirement for the geomat is only 2 feet. And basically, I mean, it's a thin mat. The liquid is pressure dosed, so it's spread over each of the lines, basically sprayed into the mat, and then filters down through, of course, like a Presby sand, of course, washed concrete.
Great, thank you for that explanation. And just the last question for me is, so basically you needed a sieve analysis because you just kept hitting groundwater. I realize we're really close to the pond. Are you worried about that at all? Do we need to raise the system?
No, I think it was more, it is raised slightly here in the back. I believe the reason we're hitting the groundwater so frequently was there was a fair amount of fill there. So it took us a while to get through the fill. Well, that was kind of artificially suppressing. There was 7 feet of fill. So we're down 7 feet, and basically we were hitting water at 6 feet.
So when you start construction, you think that you'll be able to clear that up? You'll be putting in sand?
Yeah, so all the fill in this area, the old system, any of the old fill will have to all be removed.
Thank you.
One other thing, I don't know. The jet does allow for a 2 foot reduction in the groundwater, and as does the geomat. They both allow for a 2 foot groundwater offset. We can't take those because of our offsets to the well. I mean, they do clean up the effluent substantially in order to get those.
Oh, final question. So because there are going to be blowers, I assume there's something that's going to come out of the ground that's going to have a filter on it or something? I'm just worried about neighbors and smell and noise. Is that something you've considered?
Yeah, so the jet basically has a blower, and actually it's sucking air in and kind of pushing it through the, it's more an injector kind of.
Okay, good. Okay, so we don't have to worry about smells. That's great.
Thank you. Ray?
No.
Oh, I'm sorry. Were you still?
No, we don't have any. No, we don't have any vents or anything on it.
Okay, great.
Thank you.
Thank you, Kevin.
Certainly.
Ray, did you have any comments or thoughts on this?
No, I just wanted to add that Abby Graham, our interim environmental manager, reviewed this plan, as well as myself. We had an outside consultant look at the plan, and jet systems are pretty popular here in Westford, so it's not a new technology we haven't seen. There's a maintenance contract for the jet system, and geomat, although relatively new within the last 5 years, we have seen quite a few within the last year or two. All the abutters have been notified. I don't know if any of the neighbors would like to say anything.
Do we have any on with us?
I believe we have Aaron asked to unmute. Aaron, did you have anything you'd like to say?
No, I do not. I think Kevin and the plan represented us quite well, and I appreciate the support. I have no questions or comments. Thank you.
Okay.
Thank you.
And I don't know if Abby's on. I didn't know if Abby wanted an opportunity to add anything.
No, I don't think so. I think I've already discussed, worked with Kevin with the plan, and I think we kind of have it to where we need to be.
Thanks, Abby.
Yep.
Okay, I've seen no further questions. I guess my question is, can we accept all of the variances, or do we need to do them individually?
So we would need to vote on those
Approving.
individually.
Okay, I can't see them right now, so.
That's okay. So I can read them out for you if you want.
Okay.
So the first variance is Title V C10 CMR 15405 1A to reduce the requisite offset from a leaching area to a property line from 10 feet to 8 feet, abutting number 7 Dell Road, and from 10 feet to 6.5 feet along Hillside Road.
Is there somebody? Michelle?
I'll make that motion.
Okay, Michelle makes that motion. Is there a second?
I'll second.
Zach seconds. We'll do a vote. Stephanie Granger, aye. Stephanie Granger says aye. Sue Hanley,
Aye.
Michelle,
Aye.
Zach.
Aye.
Thank you. So all that variance request.
Okay. Second
unanimous?
variance is Title V 310 CMR 15405 1G to reduce the prerequisite offset from the leaching area to a private well from 100 feet to 50.5 feet at 10 Pond Road, from 100 feet to 50.5 feet at 7 Dell Road, from 100 feet to 80 feet at 8 Pond Road, and from 100 feet to 96 feet at 9 Pond Road.
Is somebody willing to make that motion to accept that variance?
I'll make the motion.
Okay, Sue makes the motion. Is there a second?
I'll second.
Zach Cataldo seconds. Stephanie Granger votes aye. Sue Hanley,
Aye.
Michelle,
Aye.
and Zach.
Aye.
Okay, that passes unanimously.
Okay, number 3, Title V, C10 CMR 15405 1-I to allow the use of a sieve analysis where a percolation test could not be performed due to groundwater interference.
That's it? Okay.
Yep, sorry.
I will,
Yeah.
I will make a motion to accept that variance. Is there a second?
I'll second.
All right, I'm going to go with Zach. I heard him first. Zach seconds. Stephanie Granger votes aye. Sue Hanley,
Aye.
Michelle Petoniak Crawford votes,
Aye.
and Zach Cataldo.
Aye.
Thank you. That passes unanimously.
Great, last one, Title V 310 CMR 15405 IG, and from the Westford Board of Health Regulation 6.4 to reduce the requisite offset from a well to septic tank. It's a Jet 500 and a pump chamber from 100 feet to 50 feet and 45 feet respectfully.
Is there a motion? Okay.
I'll make the motion. Yeah, I'll make the motion.
Sue makes that motion, and second.
Aye.
Michelle Petoniak Crawford seconds. All right, Stephanie Granger, aye. Sue Hanley,
Aye.
Michelle,
Aye.
and Zach.
Aye.
And I'm sorry, I keep switching on names. All right, so that passes unanimously. And thank you, Kevin and Aaron, for the work you've done with the department to put together a plan that manages in the tight situation there.
Thank you very much.
Good night.
Thanks,
Have a
Kevin.
nice- All right, thank you. Have a nice.
Okay. So if we can see the agenda again, Ray.
Sure, absolutely.
Sorry, I'm on the one computer and my phone's dead. So
Nope, not a problem.
thank you. Okay, so we are on to COVID updates. The data review and discussion. Ray, would you like to take this away?
Sure. So where do we start? COVID updates are, we are in another surge, as we're all aware here. I can't say enough how the cases are quite high, both in the schools and for our residents. However, we have good news. We have a really high vaccination rate, and I do have that data up. I also wanted to share where folks can find a COVID test. I know that's an ongoing question that we receive daily here in our office. They also want to know where they can get a vaccine or a booster. So I do have that information to bring up as well. I will say that our department has been working actively to acquire a certain amount of tests for our residents here as well as employees. We've been working with the Department of Public Health, working on FEMA reimbursement, and we actually have an Arpa request in for tomorrow night for the Board of Selectmen. I believe it's for $75,000 for COVID kits for the public. So I'll attend that tomorrow night to see if that takes place. But before I did that, I know Gail wanted an opportunity, our public health nurse, to give some updates on her cases, contact tracing, things of that nature. I will say that we have brought on 3 new contact tracers part-time here to help with the caseload. And I know Gail can speak more to that. She's been 7 days a week right now, so.
Thank you, Gail.
The opportunity to speak today. Yes, so as far as the month of January, from the 1st until today, we have about 431 in Maven. Those are residents. And then I just broke it down a little bit more, and we had 294 just in the last 7 days. Now, again, the math might be a little off, and cases, there's so many cases that are going on right now. It's very difficult to keep track. As Ray just mentioned, we do have 3 contact traces that are helping. I still have our school nurses still very much on the sideline. All the school nurses are doing their contact tracing in the schools. And we're just trying to keep up with the hundreds of cases that we've had. And so Ray and I have been in touch every single day just about the case count and just trying to divvy up the cases, which mean residents is positive. What's not counted is any of those home tests. All the people that have had home tests are not in Maven. They're not accounted for. So the case count is very different. I'm giving you what's in Maven, but really the truth is it's probably so much more than this. It's just, we can't, all the people that are taking tests or that are sick at home that can't find a test, can't find a PCR at all. And so, those are even going uncounted. People who are sick but can't find tests. So
thanks, Gail. I just want to make sure that we're really clear for people to understand that Maven is the number, which used to be a fairly comprehensive number, but is no longer really.
I'm sorry, you're breaking up.
Comprehensive picture of the positive cases, because at-home test, Maven cases, we understand that is only a fraction of the number of cases that there are. Oh, okay, sorry.
Yeah.
I'm missing. Somebody else who has a better connection want to reiterate what I was saying?
So, yeah.
I'm trying to understand what your question. I'm so sorry. So the cases that are in Maven are your positive cases that have been through a lab. And that's where, when the lab gets the results, then it goes to the Department of Public Health and it goes into my database. And that is reportable. All the home tests that people are doing, most are not reportable to the state, and those are unaccounted for. Right. Is that so what you asked?
Yeah, right. Thank you. I wanted to clarify that and to help people realize that when we report 300 we understand that that's only a fraction of the positive cases.
That's true.
So thank you.
And can I just say, in some cases, what's happening too is, I always tell people though, if you test positive at home, you should absolutely let your primary care know so that it's documented, it's in the record. I tell anybody who, tests at home for their kids to call the pediatrician. Some pediatricians' offices are saying, don't even bother. And some are, setting up PCRs. So, no matter who tests at home, and please make sure you do follow up with your primary care and report your positive test. I think that would be very helpful. And then it's in a record somewhere that, you had tested positive.
Which can be important for travel and for other things in the future. The other thing I would say is that the state has also been emphasizing that because there is a shortage of tests, if you, vaccinated or unvaccinated, have symptoms and don't have access to a test, you should consider yourself positive and isolate for the 5 days or as long as you are sick and needing to isolate. So in the absence of a test, you can still consider yourself positive based on your symptomology. Gail?
Can I
Yeah.
add one more thing? Just because you just said that, it prompted me. For anyone who's listening to us today, when we count, it's based on symptom onset date. So in other words, if today I became symptomatic, this would be day 0. Tomorrow starts day 1 for the total of 5 days. And on day 6 is the date of release of isolation. But to wear a mask for the remainder of those 5 more days in case you are still infectious. But if you're still sick, as I say, it doesn't always wrap up in a pretty little bow. If you're still sick, stay home until your symptoms have markedly improved. And if you are asymptomatic and you tested today, let's say, then today is day 0, tomorrow is day 1. And again, full 5 days of isolation, day 6 is your date of release if you are markedly improved and have no fever for 24 hours.
And continue with the mask for an additional.
Wear the mask for, yeah.
Thank you.
A lot of people also ask if they have to take another test to come out of isolation, and they absolutely do not. So,
Thank you. Are there any other comments or questions on the situation? Ray, I know you have kind of put out there that given the large numbers of cases and the situation where we really don't have the full case count, that right now you're going to more indicate for the community whether we're going up or down and not necessarily breaking it down by age groups and everything anymore.
Yeah, we want to propose, Gail and myself, we've been talking here in the department, and the case count is significantly high. There are so many folks that are taking home kits, which is great, but they're not self-reporting. So those that data does not go into the state Maven system or surveillance system. So we don't have an accurate number. We can tell you, what lab tests and positive tests are going into Maven, and we can give you that number certainly each week, or let you know that, we're in the hundreds or there's an uptick, or cases are going down, that kind of thing. But we want to make sure we're giving the most accurate information. So that's our proposal. We're working on updating the website. The science is changing every day, where we receive up to 50 emails a week just between the CDC and the state with all kinds of updates, information on COVID testing, things of that nature. So you can see here, I just wanted to let the public know this is the interactive data dashboard, and this is on what's called the Massachusetts Department of Public Health. You can go on and you can put in Mass Department of Public Health or MDPH, put in COVID. You can look at the COVID dashboard. This is updated every week. You can see right here, it's up to date today. You can also look up city and town data. You can see vaccination rates. Westford's doing very well. We're well above the 90s in most age categories. except obviously under 5. But we are doing really well. I know DESE today extended the mask mandate for schools. I just wanted to bring that up as well until February 28th of 22. But, you know, this is a place to get some great information reporting. We'll make sure these are all linked on our COVID page for the Town of Westford's website. We do also update every week. We try to update as much as we can. For instance, the CDC did just change the isolation and quarantine guidance. So we make sure we put that out on our Facebook page. So I encourage residents to sign up for our social media if they're able to. And I think that is it, unless you have any specific questions. VaxFinder.com is a great place to find vaccine. You can put exactly what you're looking for, whether it's a booster vaccine or it's your first vaccine, what kind you're looking for. Many sites have opened this week, and I know the Department of Public Health is hoping to open more sites for next week to bring them on board. I know our biggest complaint is COVID testing right now. Those are difficult to find. Some people are waiting 4 and 5 hours in line to get one right now. The Department of Public Health, we're on the phone with them every week trying to encourage more sites. I would say to look at your local pharmacies, Walgreens, CVS, and you know, reach out to your doctor's office if able. One last thing I would say is if you're looking for a COVID test, not to go to the emergency room. The hospitals right now have indicated, in Emerson, Neshoba, Lowell General, they're all overwhelmed right now with cases. So I would say your best spot to get a COVID vaccine test is to look on these websites.
Thanks, Ray.
Sure.
Can I just give one quick correction? The Vax Finder is vaxfinder.mass.gov.
Thank you.
Can I just say one more thing on a positive note?
Yes, Gail.
A positive note. I have run 4 clinics, first dose, second dose, and another first dose, second dose for the 5 to 11-year-olds in town. And we have a total of 603 5 to 11-year-olds vaccinated.
Thank you. That's great. I'm frozen again.
There we go.
So I keep freezing, which makes me think if we're going to move to any public comment, I might need somebody with a more stable connection. Can anybody hear me?
We can hear you. We can hear you.
Okay. I can't tell if so I can try, but if I totally slip out there, Zach, will you take over? All right. So it is now 6:38, and I think that I don't know how many participants we have, but we'll try and limit comments. How long did we have in here till 6:50?
Yes.
So we'll try and stay within that time frame. And remind people to be very brief. We'd really like to ask people to only share comments that are new and different from things that have been previously shared, questions and such. So we can go ahead and we're going to limit to no more than 2 minutes.
Okay, so the first person we have is Alexandra Gonzalez. Go ahead.
Alex Gonzalez, 2 Elm Street. By the sword we seek peace, but peace only under liberty. If that sounds extreme, it's ironic because it's our Massachusetts state motto. Life, liberty, and the pursuit of happiness. This is what our founding fathers emphasized, our inalienable rights. And those rights are what distinguishes us from other countries. Maybe you don't want a history lesson, but you need to be reminded lest you continue to overstep your authority. We are guaranteed those inalienable rights, whether you agree or not. Which side of history do you want to be on? I believe these mask mandates and vaccine mandates will be a black mark in our history. September 23rd, 2021 was when your board invoked the mask mandate. That was 109 days ago. And look, even with masks, people are still testing positive by the droves. The board may feel justified by these increasing numbers of Omicron, but cases don't necessarily equate actual sickness. It's also clear that Omicron, for the majority of people, is a cold or at worst, it's flu-like symptoms, people who are most vulnerable should take precautions based on what their physician recommends or what they themselves believe is best. But at the same time, public policy needs to recognize the inalienable rights of people, in particular healthy people who have their jobs to do and lives to live. That's what pursuit of happiness means. I go shopping in Chelmsford these days. There's no mask mandate there. And you know what? A lot of people wear masks anyways. The difference is that they have the choice. They have the freedom to decide for themselves. Your constituents are getting tired of this. If the board doesn't show us that you care about our rights or that you trust our discretion, why should we trust the board? Make masks optional. All healthy individuals should be back to business as usual. It's better for mental health, better for economic health, better for people to move on from fear and reactionism and move toward a place of understanding and
5 seconds.
Yep, that these viruses will most likely be here for a long time. And the latest virus is a mild one, as I've said. People are getting...
Thank you. That's your 2 minutes. Just to keep things moving, but very quickly, I will say that as much as you're giving us a history lesson, you can take a history lesson too on the history of mask mandates and other public health interventions. It goes both ways.
Can I make one comment too, Stephanie?
Sure, Sue.
So with the new, what's interesting is with our new regulations, or it's not ours, CDC, MDPH, that you have to mask for an additional 5 days. So when you've tested positive, you now have to mask for an additional 5 days. To me, it makes having a mask mandate even more important with the guidance that we have right now from Mass Department of Public Health and CDC. We have, reduced the isolation period for people, but they have to wear masks in public for an additional 5 days. For people that have had COVID and are against masking, I don't believe they would. So to me, in Massachusetts, in Westford, because we have this mandate in place, I think it really is a good thing for everybody, because if somebody's just come out of isolation, we know everybody's going to be masking. And so it doesn't make any difference whether they've just come out of isolation or not. So I think these new regulations really help support the need for a mask mandate in town.
Thank you. And I think it also shows that we support each other and aren't just calling out those who've been sick and making them stand out separate from everyone else. All right, our next person.
Sure, is, forgive me, Sarah Cheminsky.
Hi, Sarah.
Sarah?
Sarah there?
Hi, can you hear me?
Yes, we can hear you now. Go ahead.
Oh, great. Thank you so much. My name is Sarah Chmielewski, and I live at 17 Shelley Lane. I just wanted to, this is my first time at the Board of Health meeting, and I wanted to thank all of you for all of your expertise and experience, and everything that you bring to the table is just so incredible, and we really appreciate it as a Westford resident. So my children are both in the public schools, and they wear masks all day and they are fine. They don't ever tell me of any issues at school. I haven't heard of any issues at school. It seems to go well. And we also, my family chooses to shop in Westford exclusively because of the mask mandate. We feel more comfortable there, knowing that there is a mask mandate in place. So we appreciate that extra bit of requirement. And then, so I think that is all the new information I want to provide. I appreciate all the information that Ray provided earlier too on the vaccines. And we've all been boosted and vaccinated, but looking for tests as well. So that was great information. Okay,
Thank you.
That's it for me. Thank you.
Thank you very much.
All right, and we have Leanne Clegia.
And please remember to do, I forgot with our first speaker, but please remember to state your address and name for the record. Leanne?
Leanne?
You've unmuted the wrong person.
Oh,
I apologize. Leanne, are you there?
I am. Can you hear me now?
Yep.
Thank you. Leanne Kalergis, 2 Lawson Road. The issue is simple and glaringly obvious. Wearing masks and getting vaccinated, which you were told to do to save others, keep your job, and get back to normal life, have neither protected you from getting COVID or from passing it on. You haven't been liberated from anything. Instead, you're still mask wearing, social distancing, testing incessantly, and living under the threat of more to come with no end in sight. The metrics you use to justify these measures are case counts instead of how many are severely ill and hospitalized. Schools, businesses, entertainment, and sporting events are being canceled due to rising cases despite their vaccinated-only requirements, which further proves the policies don't work. The masked and vaxxed are still getting sick. People are suffering needlessly. Trust has been lost. And yet you order everyone to wear a mask everywhere, which is about emotions, optics, and control, with nothing to support science, health, and safety. You promote vaccines exclusively and do nothing to develop a public health campaign about prevention and early treatment that is markedly reducing spread. You do nothing to recognize natural immunity, which is greatly times more effective than vaccine immunity. It's perfectly okay to realize you've made a mistake when you ignore the facts that are literally all around you, but it becomes a problem when you choose to continue the ignorance. To deny your error is willful blindness. When you look around and see the physically and emotionally injured around you due to masks, vaccines, and mandates that you endorse but aren't working, how will you reconcile the fact that you didn't have the courage to face the truth that's staring you straight at you right at this very moment? Please restore unity and trust by promoting health and freedom of choice instead of blind compliance to failing top-down medical tyranny.
Thank you. I'm just going to respond in saying that the overall goal of the vaccination program was never to completely prevent illness. It was to mitigate and reduce the symptoms to keep people healthier, and we are absolutely seeing the result of that. And I'm going to leave my comments at that. Anybody else need to say anything? How many more do we have in the queue, Ray?
I don't have any more.
Okay, that's great then. Thank you.
Oh, I'm sorry. Someone just raised their hand.
Okay, one more.
Yeah, nope. Now we have two more.
Two more. Okay, we can take two more, but that will be it for our time. We'll be a little over.
Okay. Olga Fratkin.
Can you hear me?
Yep.
Yes.
Awesome. So my name is Olga Fratkin. I live in 34 Caldwell Drive, and I will ask again, and I think I'm already asked to provide for Board of Health to provide some crucial data, and which gonna make we need more transparency from the Board of Health. We need to know how many hospitalization. You're saying that it wasn't, that it's working, and that's exactly what you intended to do. But how do we know it? Do we know what is the number of hospitalization? Is it raised? Is it the same? Based on the data that I read with Omicron, the number of hospitalizations stayed the same. Do we have a rise in deaths? We have more people that vaccinated, not vaccinated, getting into the hospitals? What is the comorbidities, age groups? Can you provide this information? Last time you said you don't have funding, but you have a funding to hire new 3 contact tracers that can go through all the databases, but they can provide a basic transparency to public. I mean, we're losing any trust. We're in a deep trust crisis. We need this information. So we can't, you making those decisions based on this information. We're asking you to provide it. I'm willing to volunteer. Tell me, or how much funding do you need to provide this basic data? I mean, how can we know that you making your decision based on it? You trying to convince the public that it works. How do we know? You're just counting the cases. Cases doesn't say anything. We were supposed to flatten the curve, not to overwhelm the hospitals. If the hospitals are not overwhelmed,
10 more seconds.
What are we doing? No, I have 2 questions. So how much funding do you need? And do you prefer to hire 3 contact tracers versus just provide the raw data to the public to have some
Thank you for your time.
Can I make a comment?
Go ahead, Sue. We'll try and answer some of these questions.
So first of all, I don't understand what data people are looking for when we have cases through the roof. It's mind-boggling to me. And why it seems to be so difficult for people to wear a mask is also mind-boggling to me. And honestly, if you're more comfortable going to shop in Chelmsford because they don't make you wear masks, then I feel more comfortable with you going to Chelmsford. I don't want to lose the businesses in town, but I know with all my heart that there are way more people happy that we have this in place than people that are not. And we seem to hear from the same group of people every single month. It's not new people coming in to say, I'm upset about the mask mandate. Right now, the cases are through the roof. I don't understand why you would need any more scientific data to support the need for masking.
Thanks, Sue. And I will address a couple of those points because those, I don't understand how you honestly don't have the answers that you're seeking there. Omicron is providing a dramatic number more cases. We have, if that's, in all the news, it's
your connection's not good.
Evident what you look. There are many more cases right now. Because of the vaccine, we are seeing a less serious symptoms needed. Vaccinated are still
Stephanie, I think we're losing your connection.
Frozen.
I think we're losing your connection, Stephanie.
Hello. Okay, I'm sorry. Sue, could you hear me?
So we kind of lost you a little bit, Stephanie. Yeah. Ray.
Yep. So I just wanted to mention just a couple things, and I really appreciate everyone's comments, and I appreciate you taking the time to call in and attend the meeting. For as far as putting up more information, my job here is to certainly not only support our board, but to support the residents. And so when I say that, we try to get up the latest science and information. I can certainly put up the NIH. You can look that up and you can punch in any hospital in the area and see that all the hospitals are overwhelmed right now. They put up how many deaths are in the hospitals, how many residents they have, how many cases and ICU numbers are listed for all the hospitals in our area. So we can certainly do that. But we do put up as much information as we receive. Like I said, that it's constantly changing. As far as funding goes, we have put in, our Board of Health has put in a request for Arpa funding for a social media manager to help put that information up. Right now, our contact tracers are overwhelmed right now with cases. So I just wanted to, answer those questions for you.
Thanks, Ray. And I'm sorry that my connection is apparently unstable. It shows I have great connection, but it keeps cutting out. It sounds like you covered the majority of it, but the hospitals are overwhelmed because there are so many cases, people are still ending up there, and it's primarily unvaccinated.
And you do have that one last.
Okay, let's have our one last.
Sure,
person.
Wendy Welch.
Can you hear me?
Yes.
Oh, great. I guess I'd like to also thank you guys for doing this. I was on a board.
Sorry, Wendy, can you state your name and address?
Oh, sorry. Yes, my name is Wendy Welsh, and I'm in the Bell Westford Apartments. And so people are still getting COVID even after they're getting the vaccines and the boosters. So I know people who've been vaccinated and they've gotten the booster and they still come down with COVID. And Mrs. Granger correctly said that it doesn't stop the spread, but it lessens the symptoms. So that's something that I've heard as well from many experts. So if someone gets really sick, they're going to stay home. But if someone gets COVID and they have symptoms that aren't as strong, they might go out into the public. So wouldn't that be called an asymptomatic carrier? So it doesn't make sense to me why it would be mandated, because I think we would want fewer asymptomatic carriers out there, people who are having symptoms that aren't as strong, but still spreading. So that just.
I'm sorry, I'm not quite understanding the question. Why? I think if people know that they're positive, they're required to stay home and isolate for 5 days.
But if you're if you got the shots, the vaccines and the boosters, and you have sort of mild symptoms, you might just think you have cold. You might not know. You might not have. You might think to yourself, well, I've been vaccinated, so I don't need to go get the test. I mean, I only have a small cold.
Can I address that? Because,
sure.
Yeah.
Please.
So we are seeing so much breakthrough cases right now. And what I find with people is that they realize the Omicron variant, what's nicer about it than the Delta was that it's affecting our nasal cavity more than our respiratory. So we're not seeing people getting quite as sick, but people are aware because of the news and coverage and all that. And I work in a school system, and people have said this to me over and over again. If it wasn't during a time of COVID, I would have just thought it was a cold. But because of the Omicron, what we're reading about, and the fact people are doing the right thing and they're getting tested. So we have, I mean, most of the kids that I'm dealing with at school, you know, that's how it starts. Head cold. It's a headache. It's a cold. And they are doing the right thing and getting tested. So thank God people are vaccinated. Thank God they're boosted. And I don't want people saying, well, we might as well let people get really sick so that people aren't asymptomatic walking around. That's what it sounded like you were saying.
Well, I guess what I'm trying to say is that, I mean, I can kind of sort of understand something maybe mandated if it absolutely makes you not spread. Like if you're never a spreader.
There's nothing that will do that. The purpose of masking is
that's not true in some other vaccines. I'm not anti-vaccine. So there are definitely vaccines out there that will, make you not spread.
Right. It's not our current COVID vaccine.
But that's not the COVID vaccine. It's a different thing.
Yeah. Are you saying you don't think we should have a mask mandate? That's what I'm confused.
I'm not really talking about the mask mandate.
Oh, okay.
I'm talking about a vaccine mandate. We
don't have a vaccine mandate. We have a vaccine that we absolutely encourage. Yeah.
They definitely come on the table later. It's good to think of.
Okay, thank you.
Lost her.
Yeah, sorry we lost you, but yeah, at this point there isn't a mask mandate, but I think that
I mean a vaccine mandate.
A vaccine mandate. Sorry, thanks. But what is important, I think, to what her concerns were is that we do mask, because that is, if we are completely unaware that we are, an asymptomatic spreader, at least we're wearing masks and helping, but masks are not a full protection. So we can only do what we can do.
Well, and they're encouraging now to move away from the cloth masks and to actually move in the schools. Now we all are been given the not the N95, the K95 masks. That's what we're all wearing in school now. All staff are wearing those.
So, it's a good thing. There is some good research out there. I think I asked Ray to share. Did we ask you to share? Maybe not, but there was a good article we could link to about different types of masks and their efficacy. We could put that up on the page too. All right, great. Thank you, everyone. Let's go on now and discuss the discussion of the vacant environmental services director position.
Sure. So the environmental services director position is currently open. Here at the health department, we'd like to post that position. Our understanding was that some of the board members there had been a discussion a few months ago regarding this position and possibility of a title change for the position. And I was asked to inquire what that would entail. Make any changes we want to, both to the position or just to the title. But if we do so, it's a non-union exempt position, in which case that would need to go in front of town meeting that is in June. We would not be able to fill the position until town meeting if any changes.
Or could we hire it and then change it?
If the person that's hired is on board with that, certainly.
I just think this is a good opportunity to discuss the structure. I think Ray is kind of uniquely positioned, since you've been here for so long in many different positions, to address maybe whether we reevaluate whether we need this position or whether we need something different.
Yes, I agree. I think an assistant director position would be ideal. We definitely need someone to help with plans for septic, to help Abby she's our health agent. I think from our perspective, an assistant director would be a great title change, but speaking with Abby, we just can't wait till June as far as a position change. So I don't know if that's something that the board's willing to go with at this.
Well, let me ask you. I think that makes a lot of sense too. Would it involve changing bands at all if we went with an environmental services director? We filled that position, letting those candidates know that we're actually kind of changing this position a bit. Do you think that we could actually keep it in the same band? And I don't know if you got that, Ray. It looks like maybe you locked up. Maybe we lost Ray. I'm not sure. Ray,
I'm here.
Okay. Sorry.
I lost you for a minute. Your screen went black. I apologize.
Okay. Yeah, I was just asking basically if you thought that if we hired someone as the environmental services director and then did change them to, let's say, assistant director or assistant to the director, if that's the same band, or are we talking moving that band? Like, what's your thoughts on that?
I would say staying at the same band.
So is it that if we change the title that we have to go to town meeting? Yeah, interesting. So just even changing the title. Okay.
What about the job description? Can we change the job description without going to town meeting?
To make any changes to the job description, we would need to go in front of town meeting. Correct.
Okay. So that is really
That's kind of news to me. I don't recall that we've had to do that in the past.
Yeah, I did check with the town manager's office to see, if we made some changes to the title or job description. I've checked with HR. My understanding is February. I don't have the exact date in front of me. It is in February that we need to make that proposal for town meeting to make sure that we certainly get
check with legal, Ray?
Yeah, because having gone to town meeting for many years, I don't recall ever hearing about this, and I can't imagine that all the years I've gone that I wouldn't have heard about this.
And we changed the health director job description. Going to town meeting.
Okay, I will definitely check
that regularly. So if we're just updating a position without changing the band, without anything else.
I will certainly check.
Yeah, because I totally get it if we're moving bands around, but yeah, that does sound like we should have the authority. I thought we did have the authority to do that.
I will certainly check. I'll check with legal. Absolutely.
Okay.
It really feels like our hands are tied. So I think it's worth pursuing.
Yeah, trying to figure that out.
We don't want to wait until June to fill this position.
Yeah, I mean, my thought would be, I don't know how you guys feel, but that obviously we want to get this filled. If it is possible to do, and maybe tonight we could even vote contingent on what you find out, Ray, but I would be open to voting to fill the position, letting the candidates know that we're going to be changing the title, or maybe we are allowed to change the title before we even start interviewing. Because, we don't want to wait months.
I agree. It would be great to certainly vote to fill the position with this title, and in the meantime, it can certainly, if it's just a title change you're looking for.
Well, it's a little bit on the job description, but not dramatic, really. It's
more in the tweak range, this is not a major overhaul, but it's, things that you've learned over the years, I think we could incorporate into the job a little bit better.
And make it a little bit broader. So, yeah.
Okay, not a problem. I will check.
So, I'll just make a motion if it's in the board's, if you guys are open to it. I'll make a motion that we fill the environmental services director position as soon as possible, with the proviso that we are going to change the title to something like assistant director. Yeah. Keeping it in the same band, but that Ray will check with legal to see if that's something we can do.
Absolutely.
So that's my motion.
Is that, you made that motion?
Yeah.
All right, I'll second it. If you repeat it.
You can make me repeat it. Thanks, Sue.
But I agree, Zach. Yeah.
I'm happy to repeat it, or was that clear?
Yeah, well, is it written down somewhere so that we know?
Is it in the minutes?
Is it in the minutes?
Yeah, we're recording this,
Okay,
right?
all right,
Yeah?
okay. All right.
Okay,
And I'll second.
Doesn't Zoom give you like a transcript or something?
Yes.
Oh, good, okay, all right.
Technology, you know?
Motion made by Zach, seconded by Sue Hanley.
Yeah.
Stephanie Granger, aye. Michelle?
Aye.
Crawford, aye. Sue Hanley?
Aye.
And Zach Cataldo?
Aye.
Okay, so that motion passes unanimously. I think we all understood the goal
Great,
there.
thank you. I did also want to mention today, Arnie Price,
Oh, yeah.
who's been with us for 16 years as our food inspector, who we love dearly, has given his notice today. And so we're going to miss him tremendously.
Yeah, please pass on our best wishes to him and our best gratitudes and thanks. I mean, he's been just amazing over the years. I can recall times at the farmers market where he was just so great, working with so many different vendors with so many different problems. He was educating them.
I'm the one losing. Sorry, but we will really miss Arnie and
But we really wish him well and a happy, healthy retirement.
Absolutely.
Well deserved.
Yeah.
I'm going to miss him. He's a good friend. So,
When is he officially retired?
He's so gracious. He gave us 7 weeks. So he's leaving at the end of February. And he's been great about, if he needs to stay on to help, if, he's volunteered to do so, to make the transition easy, which is just wonderful. So
That's so nice of him.
yeah.
Yeah.
All right.
Oh, sorry. My connection is supposed to be outstanding, but it's flaking out.
Well, you're in another state. Probably that's why.
So thank you, Arnie. Okay. Our next thing is department employee updates, an introduction of Brittany Nash and et cetera.
Okay. Well, Brittany Nash is our absolute wonderful brand new regional community health and wellness coordinator. Brittany has been hired with our public health excellence grant. And this grant is a grant that our community was awarded. We share this grant with the town of Acton, town of Dracut, city of Lowell. And Brittany has been hired to help with mental health, substance abuse, and community health programming for our health department. So we are the host agent. So she is sitting here in our department for physical space. And we're just so excited to have her start with us. So we wanted to introduce her tonight. Brittany, are you there?
I'm here.
Okay.
Welcome, Brittany.
Thank you. I'm glad to be here.
So, we just wanted, Brittany unfortunately couldn't be on video this evening, but we just wanted to give her an opportunity to attend one of our Board of Health meetings and for you to be, if you had any questions for her. She has a tremendous background that I think will be really beneficial, not only to the department, but the community. So I think this is your second week, correct, Brittany?
I believe this is my third. I started on the 27th. Yeah. Time flies by.
All right.
Thank you. I'm glad to be here. Sorry, I don't have video. I'm not feeling so well. I'm actually working from home right now. So
well, feel better and thank you for your work for us.
Yeah, anytime. I'm happy to be here to learn more about the community. And also the position also requires me to work with Dracut, Lowell, and Acton. So I'll be conducting those community health needs assessments for those communities, and then down the line implement programming that will be beneficial to all of the communities, and then also pull from the resources that are already existing. So it'll be really nice. It'll be a good resource, especially working so closely with all 4 communities. I'm excited to be here. Just getting started. So thank you for having me.
Thank you, Brittany.
Welcome aboard, Brittany.
All right, so that's Brittany, and as I mentioned earlier, our Arpa funding was approved for 3 contact tracers from the last select board meeting. So we have brought on all 3 of those remote positions, and they just started last week with Gail. And they have been very helpful. They are all temporary employees that work 19 hours a week. So they have been taking on cases 7 days a week here in our department. So those are just some of the updates we wanted to mention, and that you're aware of the 2 vacant positions coming up.
Thank you, Ray.
Sure.
I'm sure they have been very busy. Okay, it's like my connection is unstable, so I don't know. Zach, would you like to take over the meeting and conducting, and I'll...
Sure, happy to. Let's see, our next agenda item, let me just get my agenda open here. Next agenda item is an update on the ARPA funding request and discussion.
Yes, so I was hoping to bring that up here today for you to see. I know I sent that in the packet. The ARPA funding, I just wanted to make note that at the last select board meeting in December, the select board were able to approve both Gail Johnson, our public health nurse, for fiscal 23, fiscal 24 and 25. We're still waiting for approval. The select board members felt there were several positions that were requested for the ARPA funding between several different departments. And so they wanted to see a little more information for these positions. And at this time, for the positions that they did approve to be extended, they approved for 1 year, and Gail's position was one of those. So we're continuing to attend the select board meetings and not only root for all of the ARPA funding requests, but to extend Gail if possible. The other funding requests, as I mentioned, were the contact tracing. Tomorrow night, the select board does meet, and we have several articles listed for requests. And those requests are listed in the Excel sheet that was attached to your packet. I just wanted to I didn't know if you had any questions.
So just a question for you, Ray. Do you feel like you have what you need to answer any questions from the select board?
I do. So I have been working with Tom Clay within the last week, answering any questions that select board members had from the last meeting. You'll notice that there is a $200,000 line item. What is different from the last Excel sheet that you saw is that we separated that out. So for each employee request, you'll notice it says year 1, year 2, year 3. Some things that that have changed is we've asked for a tobacco compliance inspector who could work to conduct those, not only tobacco inspections for everything from vaping and cigars, but also to provide education. So we've put that in as the tobacco control compliance inspector. We've asked for social media, part-time social media help as well. And then we did ask for one-time purchases for items such as medical supplies, things of that nature. We have requests in for kits for employees. We have requests in for COVID kits for the public. So I believe we have 7 total items that we've asked for.
And so just to be clear, you're going to the meeting tomorrow night, and so there'll be some discussion and questions for you about those things. Do you expect any votes to take place tomorrow night?
I'm hoping. I'm certainly hoping. Anyone that would like to attend, it would be great. But understanding that, if you're unable, that's fine. I know Stephanie is not able to make it, but if you could be on, that would be great. I did want to point out, I don't know if you can see it here on the screen that I've shared. But we have asked, like I said, for COVID testing. We've asked for financial help with vaccine clinics. At this time, if it's FEMA eligible, they are not making approvals for those items, and for medical supplies, because those are FEMA eligible. The one-time request that we did ask for, we asked for printing costs. Gail has to give out a lot of information for these clinics, which we have to run off consent forms and education forms when we run these clinics. So we did put in for some of those items. We asked for some mobile containers. Right now, the health department is lugging, every time we run a clinic, we're lugging equipment from a separate location. We're boxing it up, and we're putting it in the vehicle, we're transporting it to another location, we're boxing that up, we're bringing it back to the health department. So it goes through several different areas. And so we wanted to simplify that as best as possible and suggest some more containers that maybe have some rollers, make it some of this equipment gets pretty heavy with all the computers, things that we have to have for our clinics. So those are the new positions. Like I said, that I mentioned, the social media platform positions and the tobacco, and those would all be remote. We do not have the physical space here in the department. And last thing I wanted to mention about the Arpa, although it's not under the health department at this time, we're collaborating with both the school department and our social services department for interface. Interface is one piece of the requests that we have here. The school department has that covered for next year, but we are making sure that we put in a request for interface for the public for the next 3 fiscal years.
Great, thank you for that update. Are there any questions from board members? Hearing none, I guess the next agenda item is new and old business.
So COVID and booster clinics. Gail, our public health nurse, has just finished up the second COVID clinic for children as of last week. We are in the process of ordering supplies that have been depleted with all the flu clinics, COVID clinics, and we're in the process of looking for an outside vendor to help us with both booster clinics. Gail's quite inundated with cases, and so we're working to either put on a booster clinic here through our community utilizing the Mrc Volunteers, or working for FEMA reimbursement to pay nurses to help us in admin for the next booster clinic. So those things we're working on right now. I don't know if anyone has any questions about the clinics.
Just a question. It seemed like through just anecdotal evidence that there's been pretty good coverage here in Westford, like with the, when you go on to VaxFinder and so forth, that I've seen like pretty constant availability. What is the purpose of our booster clinic? Do you feel that we don't have enough like private resources in town for the boosters?
So for us right now, we would like to run one booster clinic. We do have quite a few people that have called in a wait list of people that are looking for booster clinics, not to say they haven't gone on to look for other sites that have come online this week through the state. And we work close with the Cameron Senior Center. Again, folks looking for local, where they can go locally for clinics. So speaking with Gail, we decided that we would probably be best to put on at least one booster clinic at this time, if certainly if able to. But that's our rationale at the time.
And how many people do you expect? Do you have like a sign up and you kind of expecting some certain numbers?
So right now we are required to use what's called a color system. And so all clinics you have to pre-register for. And then we have a number. So if, for instance, depending on how many nurses we have available and how many vaccines we're able to get 300 vaccines, that's a 4-hour clinic, in which case, we can certainly set the number.
Great. Any other questions from board members? And then I see that you also have listed here Public Health Shared Excellence Grant Update.
Yeah, so I just wanted to keep you updated with our public health shared excellence grant. That grant is our $350,000 grant over per year for 3 years. Our accreditation coordinator, we're meeting regularly with our coordinators for both grant manager accreditation. We meet with all of the communities that are involved in the grant. And as I said, Brittany's just come on. She's the last hire. And then the Department of Public Health has just issued us additional funding for contact tracing. So we are in the process of hiring a 4th contact tracer who will be used regionally. We are also, I just want to mention though, we are just got off a call this afternoon with the Department of Public Health about the overwhelming hemorrhaging of health departments with contact tracing right now and asking when that's going to end for contact tracing. So we are actively involved with the state to see where is the end for continuing to follow up with these cases, and can this funding be used for things like COVID kits, using things for this money for education, things that might be more beneficial than trying to track down family members that may already be done with quarantine or already know to quarantine. So that's another angle that we're also working on.
Great. And I just wanted to ask, under the 7 o'clock agenda item, it said that votes may be taken. And I just wasn't sure, were we supposed to vote on anything there? I know we were just getting kind of updates on Brittany and contact tracing employees. Do you need a vote from the board?
I do not. I do not need a vote. We did add that in. We weren't sure if we were going to have discussion with the environmental services position or, as I mentioned, with contact tracing.
Okay, great. Just wanted to make sure. Is there any other new or old business that we should be aware of, or any other questions from the board?
One last item that I just wanted to bring up was the MRC. We want to give a special thank you to not only the school nurses who have been vital to our contact tracing here in the community. They are nonstop, working sometimes nights and weekends to help us contact trace here. So I just wanted to say a special thank you to them. I know, Neshoba and Westford Academy and all of our schools here are quite busy. So thank you. And they've been tremendous partners. And the last is our Mrc Volunteers, our Upper Merrimack Valley Volunteers. They're doing everything here. They're volunteers, residents here in the community, residents here in our region that are volunteering their time to help with everything from food insecurity issues, social equity and health equity issues. They're volunteering for homeless shelters. They're volunteering for all of our clinics here in the region. So whether you go to Lowell or Chelmsford or Acton, they've been tremendous. So I just wanted to say a thank you. She did provide an update, which we will put on our COVID site, but they have provided quite a few man hours for clinics and have broken that all down. So I just wanted to say a special thank you to our Mrc Volunteers.
Great, thank you for that.
Sure.
It was really great to meet Brittany tonight. Thank you to Gail and your whole team. I think we really want to give a special shout out to Arnie.
Yeah, definitely.
We're definitely going to miss him. So we should talk offline about doing something for him. Any other questions or anything from the board before we wrap up with an adjournment? Seeing none, is there a motion to adjourn?
I can make that motion.
Is there a second?
I'll second.
Motion made and seconded. We're going to do a roll call vote. Zach Cataldo, aye. Sue Hanley?
Aye.
Stephanie?
Aye.
Michelle?
Aye.
All right, we are adjourned. Good night, everybody. Thank you so much.
Thank you.
Good night. Thanks everyone.
Bye, guys.
Again.